Welcome to Meno Musings, our monthly podcast where we talk about topics related to the menopause to help raise awareness and to support those transitioning through perimenopause and menopause. Today, we're going to be talking about HRT, hormone replacement therapy, and specifically about the current supply issues that are being experienced across the UK and what you need to be thinking about and doing if you are concerned about your HRT medication. These supply issues have in part been caused by the increased demand in people requesting HRT, which has come with the increased awareness and with increased comfort over the benefits and also the risks that are associated with this medication. And alongside this, GPs have become more educated and are feeling more confident in prescribing this as a medication for supporting and helping with daily menopause symptoms. Understandably, the supply issues are causing a number of women anxious about what does this mean for them, because HRT can, for many, be a real lifeline to making them feel like themselves and deal with these daily symptoms. Today, I'm delighted to be joined on Meno Musings by Dr. Rachel Hines. Rachel is a menopause specialist. She's on the British Menopause Society register. She's a GP, has a private menopause clinic and supports many women transitioning through perimenopause and menopause. And more recently has found there has been an increase in those coming to her to talk about this very issue. A warm welcome to Meno Musings, Rachel.
Thank you very much. Thank you for inviting me.
So let's dive straight in. HRT, hormone replacement therapy. We aren't talking about just one product here, are we?
So it's the transdermals, so the estrogen gels and the spray that there have been shortages of.
Okay, so the estrogen gels and the sprays.
Yeah.
And how does somebody know if their HRT prescription contains the estrogel and the spray well, obviously the spray is one of the products, but how do they know if theirs contains the estrogel?
So the women will know what HRT they're taking already. So if you're on the shortages have been affecting estrogel, Sandrina, and Lanzetto primarily. I think in some areas, I think patches are starting to be affected as well. There is meant to be good supply everywhere, but I think it might be affecting that. But predominantly it's the gel and the spray that have been affected.
So if you're on the gel or the spray is your medication, then potentially this could be affecting you.
Yes, it's been ongoing since February. So I think now it's quite well recognised that there are shortages.
And do we have a sense of how many people this affects? How, a percentage of the HRT prescriptions that are affected by this shortage?
Oh, I don't know. I think more women use transdermal, so HRT through the skin, than oral medication tablets. I don't know what the figures are. It feels like a lot. I predominantly prescribe transdermal HRT, sometimes oral, but it's mainly through the skin. And it's a real mix, but lots of women like gel. It's a really, it's a really popular form of HRT. So having the shortages obviously is impacting huge numbers, but the actual numbers I don't know.
Okay. And so if you are someone who is taking the gel or the spray and you think you may be affected,
yes,
and you've got concerns around this, where can you go? What can you do?
So often you will only find out when you try and fill your prescription that there isn't any, or I think again it depends very much on where you are. It seems in the country it seems to be quite variable. So I work in North London and Central London. The supply varies from place to place, but often it might only be when you go and get a repeat prescription you find out that they don't have it, or that you might not be able to get it straight away. So there are different ways you can manage this. You can either go early, so get your prescription early so that it gives you enough time to fill the prescription before it runs out. it might be helpful to get a printed prescription rather than it going electronically to your normal pharmacy. That sometimes can be helpful because then you can go to several different pharmacies. I don't know if I can say branding, a large chain of pharmacists has got an online medication finder, which is really useful because you can put in, you put in your postcode and what you're looking for, and it will tell you what branches locally have got the product that you need.
Okay, and how can you find that online finder? Is that you can just search for that easily?
It's on Boots.
It's on.
Yeah,
Right.
but it's on their website. But
Okay.
but then if you can't get hold of your usual HRT, there are alternatives that can be used. So as I said, there isn't meant to be a shortage of patches. So it might be that you'd need to temporarily switch what you're using to a different method, and then look at switching back again when the supply has been restored later in the year. So apparently the Lenzetto they're looking to remedy by July is the latest update I've had from the British Menopause Society. And the producers of Estrogel, Besins, are saying they're going to be looking to increase their production capacity, and that they are sending regular batches. So in terms of when that will filter through into widespread availability, I don't know. But there are always options. So I think the most important message is not to panic, because it may not be your first choice, but as long as it gives you the estrogen, essentially. There aren't shortages of progesterone, it's just the estrogen.
Yeah. So not to panic is really important. And if you find that you go to fill your script and you're not able to, and you want to look into this idea of being able to swap to another product that is available,
yes.
Does that require, going and talking this through with your GP, getting a GP appointment? How do you sort of go about doing that?
So there are different ways of doing it, again, depending on what it's like in your local area. I know that some pharmacists are happy to discuss the different options, and that they can offer alternatives, and then they get us to do a different prescription. You can talk to your GP or nurse about it. Quite a good way of doing it on the NHS is by doing an e-consult. So you do an online consultation, and submitting that through your GP's website, and just saying, it's quite a good way of being able to let your doctor know that you can't get hold of it. What do they suggest? It may require a conversation with your doctor, because if you're given patches and you really don't get on with them, then that could be problematic. So it kind of depends. But you can always, you can talk it through. And if you can't access the surgery, or you can't get an appointment, an e-consult's a very good way of doing that.
Yeah, because that can be often an issue, isn't it? That it is difficult to get an appointment at your local GP. So having that online is a good option to get in the door, and then hopefully even just get a phone call back and a discussion.
Yeah, it's really helpful. And I think something that's really helpful is if you use Estrogel, if you've always used Estrogel and the thought of using something different is a bit frightening or off-putting, there's so many good websites with really good information. Have a read about different types of HRT so that you feel informed about what you think you would want to try yourself. So the Women's Health Concern is the patient branch of the British Menopause Society, and it's brilliant. It's got so much useful information on it, and also Menopause Matters and Balance. So there's lots of really good information that's available. So if you've only ever taken one type and it frightens you, or you just don't want to change, do have a read about what options are available before you speak to your doctor, because it's very helpful, because then you feel more informed about what the options are. But being very honest, at the moment there is no shortage. There's not meant to be a shortage of patches, and the others there is a shortage, so it's most likely you will be offered a patch as an alternative.
Yeah. And because often when someone goes on to HRT, there is a process of sort of balancing, stabilizing it, if you like, getting the right dosage, so if you were to transfer onto a different product like the patch, would there be similarly this process whereby it may take a little bit of time to sort of get the right balance for you?
So we would do like for like strength. So if you used 2 pumps of Estrogel, that's equivalent to a 50 microgram patch. 3 pumps is a 75 microgram patch, and 4 pumps is 100 microgram patch, and if you're just using one, that's 25. You can get a difference in absorption in different methods. So when we switch, you would give the same dose that you're taking. You may find that there is a little bit of a change if you were to swap over, but it shouldn't be too drastically different. If it was swapped and your symptoms started to recur, then the dose would need to be increased.
Okay, so again, it's sort of monitoring it, isn't it? Because we know everyone's experience is very unique, and so until you go down that path, you're not really sure.
Absolutely. Yeah, so you'd want to you'd keep an eye, and it may be that you absorb much better through a gel than a patch, or vice versa. And so obviously everyone's different, and how you do absorb is affected. But at least that way you're still getting your estrogen, and then we could look at making, with your doctor, you can look at making changes as you need to.
Yeah. And then you mentioned about then transitioning back to your original product when it comes back into stock. And would that be sort of the, the more advised route, or would some maybe stay on, say, the patches?
It's totally personal preference. So a few years ago, there were no patches available. And we moved everyone onto the gel and Nutrigestan, so the progesterone. And then patches started coming back into production again. And again, it's just personal preference. So some women would be like, I've used patches for several years and now I've switched. I actually much prefer this new method. And then some people will be like, actually, no, I want to go back to what I was using before just because I prefer it. Because generally, when you're doing your initial prescription, you do make a decision together in terms of what you prefer. And for some women, you put a patch on twice a week, you don't need to think about it. Is much more preferable than having to do gel every day. Whereas some women don't like the idea of having a patch on their skin and want to use a gel or a spray and don't mind using it every day. So it's very variable. And again, it's just personal preference. So some people, when they travel, would use patches rather than the gel because they don't want to take pots of gel with them. So there is flexibility within it. And then when it starts coming back in again, then you can make the decision what you want to continue on.
So it sounds like it's try not to panic, do some reading, get yourself comfortable what else is out there, have a conversation with your GP or your chemist if they're available to talk, and see what else there might be that is equivalent that you could swap over to that will still provide some relief to these daily symptoms.
Yes, exactly that. But
and I guess not, because we have heard stories about people heading to the black market, haven't we? And buying stuff off the street, very dangerous, very harmful, not recommended.
Absolutely, don't do that. I think people have been, you do hear stories of this, or people going abroad and bringing lots back. There is stuff. So we've been advised as doctors, nurses, only to issue 3 months at a time, because often if you're stable on HRT, you may be given 6 months supply. So we've been told to pull back on the volumes we're prescribing to try and help the flow. They've appointed a women's czar, menopause czar, but someone to oversee the process and trying to get the flow, the flow and availability moving again. But I think it's just really allowing yourself enough time. So if you're given it 3 monthly, at 2 months, it might be appropriate at that point to go, right, I'm starting my last bottle. And now I've got 2 or 3 weeks left. I need to go and get it sorted then, it can be quite anxiety provoking, but just don't worry, as long as you give yourself time. And then if you spend, you go to a few different places and you can't get it, then you can say, right, actually, I really want an alternative, to make sure that you don't run out in the meantime.
Yeah, I like that actually as a key message, isn't it? Give yourself time so that you can see if you can get your usual script, and then if you can't get your usual script, you start exploring these other avenues. And you've already talked a bit about how they're working to try and increase the flow. People are obviously concerned about the immediate effect and when is it going to be resolved, and they're also concerned about, could this happen again actually? So what sort of things, I know you touched on a menopause HRT task force or something has also been set up. What sort of things are being done, I guess, to bring the immediate situation and address that, but then also more long term ensure this you won't see this repeated?
I think that's what the government, I don't know details about what's being done with that, but I know that there's sort of the task force and they're sort of focusing on 5 key areas of women's health to really focus on and address.
Yeah.
They've just announced today, Dame Leslie Regan's going to be a new women's health czar, I think the term is as well, but kind of really overseeing women's health. And she's mooted the idea of having like a half-day hub that women could go to. In practice, how long it will take. And again, in terms of the availability of HRT, I don't know how long it will take, but overall, I learned the other day that 14% of women who can take HRT, rewording that, 14% of women who are menopausal take HRT, which is actually quite a low number, but previously it was 10%. So it's a huge increase in women, and they've just got to catch up with that, basically. And it takes time, and I think they're produced in Europe, it's not in the UK. So it's so many different factors coming together with it. So in terms of when it will all settle, but with patches it felt like it was never going to be fixed, and it was. And many women were happy with what they changed to. So I don't know at what point it will happen, but it will. I do feel it will, but how soon, I don't know.
Yeah, so it's about sort of ramping up that production, isn't it, and getting that supply, and perhaps seeing ahead a bit more that it may be at 14% now, but it may be growing, and therefore we need to be thinking ahead that the supply needs to be able to accommodate that.
Yeah, certainly it will continue to grow. Yeah. I mean, without a doubt, I can't see how it won't. I think education's improving so much, and so many more women are becoming more aware of what they can take and what you can, and the general education is improving so significantly, and menopause is on school syllabuses now. So I think people are just, the general awareness is going to gradually filter through society, and I can't see how that won't translate into more women wanting HRT, which is great, and we just need to make sure we can give it to them.
That's brilliant. Thank you, Rachel. What's one sort of last takeaway as we wrap up today's podcast that you would leave people with?
I think just don't worry, which is so easy to say, but just honestly try not to panic. There will be an alternative that you can get. You will be able to. So as I said, it's the progesterone there isn't an issue. It's the estrogen that there are shortages of, but you will be able to get an alternative. So give yourself time, but don't worry. Yeah,
don't worry. Give yourself time. There will be something out there that you can take, and it's not a matter of going back to perhaps the way it was before, when you may have had a really difficult time with your symptoms.
Yeah, but just exactly. So just giving yourself time to be able to get the prescription, and then so it may take you a month rather than a day, but as long as you get it, try not to panic.
Yeah, great. Thank you so much. It's been delightful to have you on Meno Musings today, Rachel. Thank you for your time.
Oh, you're welcome. It's been a pleasure to join. Thank you.
If you would like to get in contact with Rachel, I will make sure that her details are dropped when I post the podcast. If you are looking to raise awareness of menopause in your organisation, or need help to create a more menopause inclusive organisation, then do check out our website, menopause51.com. It's been lovely to have you with us today, and we look forward to seeing you next month.